Hi there. My name is Brittany. I'm going to be your nurse today. Do you mind telling me your first and last name?
Yes, Jared Street.
Perfect. Are you allergic to any medications or any foods?
Just C-chlor, and I'm allergic to cashews as well.
Okay. Do you have any past medical history that I need to be aware of?
No. Well, tell you what, I do have acid reflux.
Okay. Do you take any medications for that?
Yes, I take Zantac 75.
Do you take any other medications every day?
No, just that.
Perfect. Any past medical history and parents or grandparents that I need to be aware of?
On my dad's side, high blood pressure and high cholesterol.
Okay. Have you ever had surgery or ever been in the hospital?
No.
All right, so today we are going to do your abdominal assessment, if that's okay with you.
Yes.
Just going to check out your stomach, check out kind of the organs in there just by listening and feeling. Make sure everything sounds and feels like it should. So if you don't mind, will you pull your shirt up just so I can see your abdomen? Perfect. So the first step of the assessment is just to inspect or to look at your stomach, make sure everything looks as it should, and it does. There's no pulsations from your aorta, there's no masses, no bulges. Everything looks symmetrical, and it doesn't look like there is a kind of a mound of fluid or anything in there that shouldn't be there. Something unique to the abdominal assessment is that we listen before we palpate and percuss, just because if you go around kind of pressing on your stomach, it will elicit some stomach noises that we don't necessarily know if they would be there or not before we're pressing. So first things first, since I've already inspected and everything looks great, we are going to get started and I'm going to listen. I'll kind of go in a circular motion and let's see if this is nice and warm. So first we are going to start with your right lower quadrant. And typically we listen for 15 seconds. Then we'll go to the right upper quadrant. And in each quadrant you should hear anywhere from 5 to 35 sounds while you're listening. Left upper quadrant is next. And left lower. Your stomach sounds are great. So now we're going to listen to your aorta. I'm going to make sure that it sounds like it should. I don't want to hear any broomies. That is something that we would hear if there is some turbulent blood flow going on. So if you're having something that's not supposed to be there, or if it's kind of blocked by any means, then we would hear it that way. So first I'll listen with the diaphragm, or kind of the bigger part of this, and then we'll listen with the bell. And it's kind of right above your belly button or umbilicus. Next, we are going to work our way down and listen to the iliac artery. It kind of branches off of the aorta. I'll go from side to side listening with the diaphragm, and then I'll listen with the bell. And again, I'm still listening for broomies. Again, we're going to listen with the femoral artery. And typically I would listen under your clothes. You would also be in a hospital gown, so it gives a little more access, but it's kind of right in that growing area. And we'll go from side to side. flip over and listen with the bell. Perfect. Now, are you having any issues with pain today? Have you had any changes in your bowel habits? Any changes in your stomach sensations? Anything that you want to make us aware of?
No.
Okay. Any issues with your throat? Do you feel like your acid reflux is pretty well under control? Zantac seems to help.
Yeah.
Okay, good. Have you had any blood in your stool? Any changes with your bowel habits, or everything seemed to be normal to you?
Yeah, normal. Everything seems normal.
Okay. Do you have a bowel movement every day, or what? How often are you going?
Yeah, on average every day.
Okay, perfect. I am just going to kind of percuss around or tap my finger, and I'll go in the same circular motion. This lets us kind of listen for the certain sounds that it elicits. It'll let us know if we're tapping over something that is filled with fluid or air, or if it's something that's a little more solid, you know, like an organ or something. So we'll start in the same spot. And go all the way around. Perfect. Good deal. Okay, now we're going to lightly palpate. Just check around your umbilicus, make sure there's no masses in there. Let me know if you feel something, or when I'm pressing, if it hurts, anything like that. Any discomfort anywhere?
Mm-mm.
Okay. I'm also going to check out these lymph nodes that are right in your groin. Just kind of lightly palpating. Have you had any swelling of your lymph nodes, even in kind of this area of your throat or behind your ear?
Mm-mm.
All right, all feels well. So next we are going to check out your kind of where your liver lies and check out your spleen. So that's considered more of a deep palpation. So what I'm going to do is slide my left hand underneath your back and press everything kind of up towards the top here. And I'm going to get you to take a deep breath in, and when you do that, I'll get you to hold it. And I'm also going to press down kind of hard and kind of underneath your the bottom of your rib, okay, or your coastal margin. Go ahead and take that deep breath in and hold. Exhale for me. Good. One more deep breath in. Perfect. Exhale. Good deal. Now I'm going to get up and check the other side. This is where your spleen lies. So we're going to do the same thing. Big deep breath in for me. And exhale. Good. Deep breath in for me. Exhale. Perfect. And actually, you don't want your spleen to be able to be palpated, because that will kind of let us know that it may be enlarged, maybe too big. Any issues with me pressing?
Mm-mm.
All right. So next we are going to check out something called Murphy's sign, and that is where I will get you to take a deep breath in, and I'll press down on your stomach. And if you have some sort of sharp pain, or if it kind of catches your breath, that's considered a positive result, and that lets us know that there's something going on with your gallbladder. Okay. So first, I'm going to locate your hip bone, or your anterior superior iliac spine. Big fancy name for that bone right there. And then draw an imaginary line to your belly button, and about 2/3 down from your belly button is McBurney's point. And so what we're going to do is I'm going to press down and get you to take a deep breath in for me, okay? Go ahead and do that. Exhale. Perfect. Did you have any pain with that?
Mm.
All right, so that's good. Next, we are going to check some rebound tenderness, and that is just going to get me to press down right here and let go kind of quickly. And if you have any pain, let me know.
Mm.
One more time.
Mm-mm.
All right, we're going to check crossing sign, and that is on this side. Let me know if you have any pain on this side or on your right side also, okay?
Mm-mm.
One more. No issues there? Perfect. Next, we are going to check psoas sign. That entails you to raise this leg up against resistance on my hand. Let me know if you have any pain in your stomach, okay? Go ahead and raise this leg up for me. And relax. Any issues in this area?
Nope.
Good deal. Let's do one more time. Raise this leg. And relax. Still no pain?
No pain.
Perfect. We're going to do this leg just to make sure. Raise this leg up for me. Relax. Any pain?
Nope.
One more time. All right, relax. No issues there?
Nope.
Okay. The last test that I need to do is the operator's test. What we are going to do is get you to bring this leg up for me and flex that knee. Perfect. And I'm just kind of wiggling it back and forth, flexing those muscles in your abdomen. Testing those out. Are you having any pain?
Nope.
All right, go ahead and relax that leg. So everything went well. I heard stomach noises where I needed to hear stomach noises. I did not hear any bruise, which is good. I could feel your liver border. That felt great. And again, I did not feel your spleen, which is what we want. If I were to feel it, that would indicate some sort of enlargement. And you're not having any tenderness that we need to know about. So all seems well.
All right. Thank you.
Thank you much.